So I am absolutely delighted to welcome you all here for a very topical MWC short. So we're going to be talking about mobile v COVID-19 today. So as we all know, COVID-19 is not the first pandemic that humanity has faced, but it is the most digitally recorded pandemic, and that has changed everything. So with us today, I'm very happy to introduce a very good friend, a trained pharmacist, and also lead of the Outbreak of Infectious Disease and Global Citizenship Program from UCL, Oksana Pijic. So Oksana, thank you so much for joining us here today. I know your schedule has been like absolutely packed out with actually kind of following the movement of the disease. So yeah, thank you for making a few moments to have us to come here today.
It's a pleasure to join you.
Cool. So, I mean, you would have probably seen the stat already. There's this absolutely incredible number going around that when we're looking at the comparison of COVID versus previous pandemics, the digital footprint of COVID, it just absolutely outdoes anything we've seen before. So Ebola has 16.2 million digital hits. I think it was SARS had 66.3, but so far COVID has 2.9 billion hits. Can we see a difference to our society's response and humans' behavior that is linked to having a larger digital impact and digital footprint?
Yeah, so in terms of that vast number, that 2.1 billion, which is really truly phenomenal, really it is a part of this is because of the reach. Every country in the world has been affected. So therefore, we can't, as usual, sort of take that perspective that it's happening somewhere in a far off land and it's not going to affect us, which is unfortunately what happens with epidemics and other disasters. In this case, it really is something that unites all of humanity. This virus has made us all global citizens because we have to respond in the same way. But you bring up a really interesting point around this is the first time that digitally it's been recorded in the way that it has, which from a research perspective is going to be brilliant because the data that we're going to get out of this to better understand in preparation for the next time that something like this comes around, and that it will, we will have much better information in terms of how quickly we need to time some of these responses, which has not been possible in the past. So one of the interesting things I think about even just the terminology we're using around this. It's referred to as social distancing, but really what we're doing is physical distancing. We're physically isolating ourselves from others to protect the ones that we love, to protect our vulnerable populations, and to prevent further spread of the disease. But again, because of the digital era that we're in, we're actually more socially connected now than we've ever been before. So not only do we have the benefit of all of this digital footprint providing data and help us with a research perspective, but also it means that it will ease some of the mental health problems that we know are associated with having to self-isolate for prolonged periods of time so that we can stay socially connected. And even when we think about the beginning of this story, the beginning of the outbreak, where we had that whistleblower in Wuhan, that brave doctor who waved the flag saying, you know, this is human to human transmission. And to the rest of the world, it was because of digital tools, social media, that actually other people were able to hear about what's happening and behind other borders.
That's such a good point, actually. Of course, that actually you're right. We actually only know about this because of social media platforms as well, right? So social media has had a lot of bad rep in the last couple of weeks around the disease, and obviously because of the platforms for spreading fake news. So, I mean, I'm sure you've probably seen it as well. Everyone suddenly is like an epidemiologist from messages that they're getting and videos that they're getting, like for example, via WhatsApp. I mean, this is, and you've got a lot of experience in this because you actually, outside of this pandemic, actually, you founded and run the global campaign on Fight the Fakes. So, I mean, I want to ask you about fake news and how do you think that that's kind of impacted the spread of misinformation in this disease?
I think this is one of the most dangerous aspects of this pandemic, actually. Dr. Tedros, the Director General of the World Health Organization, has said that the WHO is no longer just fighting the virus, but they're also fighting an infodemic, because there is so much misinformation on the internet that it isn't possible for the WHO or even governments to be able to counteract each one of these rumors that's floating around. And you also highlighted the point around this rise of the armchair epidemiologist. And but it is actually very interesting, because perhaps for the first time in history, it is true that many members of the general public will be following the data live, day by day, number of infections, number of deaths. So from that perspective, I think, just connecting back to your earlier question about that digital impact, I think that really rolls into it as well. But the darker side of that is then, of course, that not even in many cases, it's not even necessarily intentional. Some people misunderstand some of the studies that they've been reading, and from there you see sensational headlines, things that then get warped and twisted as they go through these communication challenges. So really, if we look at Fight the Fakes and the campaign at UCL, what we're part of a larger group of 37 global partners that are all working to raise awareness on actually fake medicines specifically. But as we see in this crisis, there has been a huge spike in fake cures, treatments, diagnostics. And really tragically, in Iran, there were 44 people who died from ingesting what was falsely advertised as a COVID-19 cure, and actually ended up being have very high contents of ethanol, and ended up being lethal. In Uganda, people have been arrested for selling fake vaccines. So it goes from actually the physical in terms of misleading a very fearful population. And this is really only possible because there is so much fear tied to the information that is being shared with the wider public. And it is very important that information is accessible, but there's also a responsibility of the media, of the governments as well, to ensure that doesn't then fuel these types of fear-based response where people try to take matters into their own hands and seek either treatments or preventative measures that actually end up doing far more harm than good. It's really important that we are clear that in terms of vaccine or any treatment, we are at least 12 months, if not 18 months away from a vaccine, and everyone should stay away from this. However, from claims that suggest otherwise. But the internet, the dark web, it is full of coronavirus spray and other types of products, and it's really sad. It's so sad because it just shows that people are exploiting those that are sick and vulnerable into making profit out of this terrible situation, and any additional lives that are lost as a result of this. It's just unacceptable.
Completely, it's really unnecessary, especially in the situation that we're in at the moment. I mean, and so in terms of the role of the technology companies, we've seen, and coming back to that, some of that misinformation this week and last week, there's been a rise in damage done to 5G masts, because there's these conspiracy theories that 5G is causing coronavirus and also hindering people's immune system to be able to fight it. Now, these are obviously like absolutely ridiculous claims, and a number of tech companies are now kind of coming out and trying to step up to that. So I think WhatsApp today announced that they're going to be curbing the number of forwards that you could do on a message to try and limit the stop of fake news. But I mean, as a global health expert, do you think technology companies are doing enough at the moment?
Well, so I've been very pleased to see that there's been so many collaboration amongst the tech community and the World Health Organization itself. So Google, for instance, if you are looking for information, ensures that the most reliable sources are right at the top. Twitter, Facebook, Tencent, and these other platforms are all working with the WHO to try and curb some of that misinformation that we were talking about earlier. So I think there has been a real rush in finding innovative solutions to what can quickly mushroom and spiral out of control in terms of sharing of misinformation. So also WHO has been partnering with influencers to ensure that those platforms, also their followers, are aware of the existence of the WHO in itself and some of the evidence-based information that they can access. So in terms of the type of collaborations and new ways of thinking in terms of identifying evidence-based and reliable sources, all of the big players in this industry are working with the WHO to ensure that there is a minimization of the spread of misinformation. It's going to be impossible to fully control, but all of these measures, I think, are going to help.
And I mean, when we're talking about technology companies, we have to mention Amazon, right? This is the one of the largest tech companies out there. So Amazon has been rumored to be getting ready to, basically become the supplier of COVID home test kits for antigens. What do you think about a tech company moving into a global health sphere? Like, is there anything that we should be wary of, or is this good news all around?
So I don't think this is the first time by any measure that tech companies have tried to provide innovative solutions on global health problems in different parts of the world. I think that really the one point that needs to be emphasized around this is just the evaluation, the quality assurance, because a fake positive or negative result can actually do more harm than good. So from this instance, I think that everyone is welcoming all sorts of companies, whether it be tech or outside of that space, to try and support the response to this pandemic. And I think we have seen some pretty remarkable responses come out throughout the world. So if Amazon can produce an antigen testing, so that would be antigen testing would be to detect current status of infection, whereas the antibody test, which is the other type of test, which is a blood test that measures the serology, checking to see if you have any antibodies present as a result of having the infection, those have two different purposes. Again, it helps us understand the mortality rate better if we can see how many people were infected overall, whereas crucially, the antigen test that you've mentioned, it means that people who may be asymptomatic or if they get a positive test, they're going to be far more likely to self-isolate and not go out at all, even for essentials. So families, communities, charities, the government, they've all rallied around people who are extremely vulnerable and those who are ill to ensure that they are receiving the care that they need, the food supplies, etc. But I think we can all understand that if you don't know that, even though everyone's being very careful with the social or physical distancing, that your response will be different if you know that you're a carrier. And that as challenging as the self-isolation is, knowing that you're posing a risk to others, I think is just, it should be a huge motivator to ensure that it does not continue to spread. So from that perspective, I think everyone welcomes innovators into the space if it's able to help control the current level of spread. But the crucial point on this is really evaluation, ensuring that it's effective, so that we don't really make a dramatic error in perhaps allowing people to go back to work early when it's still not safe, for instance.
Of course. And I mean, coming to your point, what better year to self-isolate than 2020 when we have more than enough things to kind of keep us occupied in our homes. So final question on this, and coming back to looking at digital footprint and digital impact. We've mentioned a few times here, this is the most recorded pandemic in human history. The amount of quantitative and qualitative data points that we have around this, because of our kind of social media channels, our digital news outlets. I mean, are you hopeful for the future of humanity in our response to this, because we have now a digital memory of how we've coped and how we've reacted and how we've essentially managed this pandemic?
So I think one of the first points that perhaps is relevant to your question and kind of shows how we learned historically from previous pandemics, because certainly this is not the first time, nor will it be the last. We've had the 1918 Spanish flu kill nearly 50 million people and many more million in the plague. So, however, despite many warnings from the global health community that this is something that every population and generation should be prepared to face in their lifetime, the US actually defunded its pandemic preparedness program, and that really has crippled some elements of the response by making it defunct. So while I think now, certainly in the speed in which governments have had to scale up, we have some kind of handbook now to respond to something that is truly global in a way that we've not seen with SARS or MERS, for instance. But the more cynical side of me says that for maybe the short term, yes, I think it's likely that our disaster funds will be better managed, and that this will be within the living memory of our generation. But going forward, if we think of the long term, we have archival records, perhaps not digital, but we do have what happened throughout history. And it just seems that unless it has physically or directly impacted the leaders of the current age, it is easily forgotten. And something else more urgent takes its place and takes the funding. Because of course there are so many global issues that we need to respond to, including climate change and others, that it becomes secondary. So there is this pattern over time that we forget the impact that it does have on society. I do hope, however, that we will be proven wrong, and that future generations will be able to save many more thousands of lives. We've already surpassed 1 million infections worldwide. And I hope that the next time that a pandemic occurs, we won't have to call it a pandemic, because it'll be stopped before then. We can stop at the epidemic proportion. But again, that really relies on government cooperation and on ensuring that we have the experts on the platform, and that there is appropriate funding to make it last over generations.
Of course. I think that, I think that's a good, hopeful message to end on there. Well, Oksana, thank you so much for joining us today. And hopefully next time we talk, it will be for healthier reasons that the world is currently in. But yeah, thank you very much for coming today.